Hi, I'm Bob Roth, Managing Partner and Co-founder of Cypress HomeCare Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show. Good afternoon. Thank you for joining us here on Health Futures, and I'm really excited today to have an extraordinary guest here with me. I've got Paurvi Bhatt. She is the founder and CEO of ThirdEyeFocus. Paurvi, welcome to Health Futures.
Hi, Bob. It's great to be here.
It's good to have you. And, you know, you're kind of my newfound friend. You and I are aligned on so many different things. I feel like I've known you forever. And your journey is one that I respect. And I would love for you to take our listeners through what that journey looks like and how you got to where you are today.
Well, thank you. And first of all, isn't it wonderful how you can meet and all of a sudden be on such similar journeys? And I think that's what taking care of each other has always been about. So thanks for seeing that and bringing that up today. So my name's Paurvi Bhatt. I am a second generation Indian American immigrant. I start my story here partly because we're a new immigration story. My dad came in 1963, steerage on a cruise boat from India, and then found himself in Europe and then got himself here on a small plane to pursue his master's degree in manufacturing engineering. And he was here in 1963, which means pre-civil rights. And he got his degree out of the University of Tennessee in Knoxville. 2 years later, when he could afford it, he brought my mom in 1965. Pre-Immigration Act is when she came. She got to fly. She'd never left home without a chaperone. And so she was coming on her own. She had to stop in Europe and change planes with an overnight stay. That makes me stress out today. And she did it in the mid-60s. And I came a year after that, 1966, once everybody was together and in Chicago. I tell a story from there because it's incredibly important, because at the end of the day, we're taking care of each other. I'll continue on the care part and then a little bit on the professional side. When I was 3, my mother had cervical cancer. And my dad was in his first job. There's no other family in Chicago where we all were because we were first generation at that time. They were first generation immigrants. And so at that time, he was asked by aunties and uncles, which are the other members of the immigrant community that were all together. They had said, listen, why don't you leave your daughter with us for 6 months and you take care of work and your wife. And when things settle down, she can come and return to you. He pushed back and said, no, I'm only realizing this now. Why I'm bringing it up is because he was a male caregiver well before we even noticed what men were doing all along the way. So without a car, he took public transportation from our apartment to an uncle and auntie's house, dropped me off. From there, went to the hospital to check on my mom. From there, went to work and then reversed that every single day for months.
Wow.
And I lived my childhood with a father that was making sure I could take care of myself. My mother had a full hysterectomy, which made me an only child. If you fast forward, I chose a career in public health. I'm a part of the beginning of the HIV movement. I'm still proudly a part of that movement now. While I know a lot about infectious diseases around the world, I purposely have focused on the economics side of it and health systems and how they're organized and how we move capital through those systems to meet the moment of what we need. At the time, it was in response to a pandemic called HIV. And it continued to move from that to women's health, to COVID when the time was right, but mainly because of these big emergencies moving from federal government in the United States to big nonprofits that were focusing on these issues around the world, to then 3 different industries: pharma, retail apparel, interestingly, because I never would have thought I would have ended up with Levi Strauss, and med tech. And I'll end on this one. The Levi Strauss part of it is the most intriguing and the most essential now, because I worked in HR and I never would have put myself in HR. And the reason why was the question in front of them is, how do we support our employees who might be facing HIV? They were the first company to actually respond. And at that point, it was around healthcare. And what did we do? If you have a US health plan today through your employer, it now covers for HIV. It's because that company asked that question and figured out how to negotiate that kind of coverage. And that kind of work and looking at a comprehensive system helps me today in thinking about these care issues. Here on where my parents ended up. My father had early onset dementia, the dementia that Bruce Willis has at 58 when I was 28.
Wow.
My mother, as you know, had her first cancer, as I mentioned, and died of her fifth cancer 3 years ago. I chose not to have a partner and children and don't have siblings and now don't have parents. Today, I'm a solo ager, a woman of color, and a professional. I am the tip of the spear of many women around me and who are coming behind me. I'm Gen X. Gen X just turned 60. We are not the Golden Girls. We are the Breakfast Club. We will forever view ourselves as the Breakfast Club with a fist in the air, deciding it's not going to be the way it was.
Love it.
And the hockey stick we see, the reason why it's a hockey stick and the way we think about data is because it pivots on the smallest point. And I'm from Minnesota, so I know the hockey stick. And I'm saying that Gen X and the women of color and the second generation immigrants and all the things that are going on are the smallest part of that stick. And we need that to work in order for all the things that we need to come after that. So that is the total story of where I'm at. Caregiving and the economics of it and end of life are all part of where I focus now, not just because of my story. And it's an important story of caregiving at the end, of taking time off for paid leave in the state of Minnesota. January 1st, we now have paid leave here. I did that alongside Melissa Hortman, and in her memory is how we're moving forward with this work. But all of that is because I was trained in this area and because I had two parents that raised me in a certain way to take care of. So it's an honor to be here with you, Bob, because I know a lot of these stories are very resonant for you.
Well, they certainly are. And Paurvi, your journey is very similar to a lot of people's journey that are in this space. But wow, I mean, you've come a long way. And X, it's hard to believe that they're all starting to turn 60. And for me, your journey really propelled you into doing the work that you do. And, my first question is really going to be centered around your personal and professional journeys have certainly intersected. And your career, as you shared with us, began with the HIV/AIDS crisis. And then you found yourself, as you shared with us, caring for your parents. Your dad and your mother influenced your trajectory in your career and certainly your perspective on healthcare and leadership. And to me, I am just, in awe of how you've really put yourself out there and you are fully in. And, this is really, really fueled your passion to the work you do. And I love that about you. And you and I got a chance to meet one another back in May in Napa. And I was really drawn into what you were talking about because I myself am a family caregiver. I have certainly never thought I was going to be in the home care space and doing caregiving professionally. But it was my personal journey that brought me there. And I really think that that's really what aligned the two of us and why both of us are so passionate about the work that we do. And we know that there's so much work left to do. Mm-hmm. And while that wasn't really a question, it was more of an affirmation, a summarization of really how you got to this part of your journey. But, you talked a lot about May, your experience working at the Carter Institute, and specifically really talking about, former First Lady Rosalind Carter. And, she famously said there are four types of four types of people out there.
Yeah.
And those people are those people that were caregivers. Those are people that are caregivers. Those are people that are going to need caregivers or they're going to be caregivers. Did I get that right?
You did. And that's pretty much all of us, isn't it? That was your point.
It is. And all of us are surrounded by this. And so many of us don't want to really talk about it. Mm. And, I really wanted to ask you how really this mission, how has it guided you in the work that you do? Because you spent a few years there at the Institute. And I think that's where I gravitated to, really, loving the work you do and really attaching to the passion that you have for the work that you do.
Well, Bob, thank you. And I want to also echo the fact that this part of healthcare, every part of healthcare, I imagine, but I can, with true authenticity, say this part of healthcare, which is when we start to lean in to take care of each other, which has been happening since the beginning of time, is the part that's the least shaped and identified. It's the part that's the most local and palpable and cultural. It doesn't matter whose home you go into. By definition, you're in someone else's culture, right? It's not a part of where in the world you're from. It's just different families. And it's the part that brings us closer together if we would only just disclose it, right? So that where you were leaving things at in terms of we just don't talk about it, we don't acknowledge it, is the first step. And so that time, which can feel like a segue in my career, of having been a part of the Rosalind Carter Institute, which we proudly have honored Mrs. Carter and sunset the actual institute, but have moved the work into the Carter Center now. And then there's incredible next generation leaders that are moving forward the work. So I want to honor the fact that the institute, which had been around for nearly 40 years, has been led by generations of leaders. And how amazing is Mrs. Carter for seeing that the two issues that she focused on, mental health and caregiving, would be the issues of our time today. And she started that journey decades ago. So that visionary kind of spirit also fuels all of us to keep things going, because whatever idea we're coming up with today is going to have legs based on that path that we're on. So just tipping my hat and honoring the team that's moving this work forward. But having said that, she found me in the mist somehow through my career. And I found a tweet, this quote that you just said of hers back when it was Twitter. It showed up through her team. And I was like, what is this that Mrs. Carter's talking about? I was just finally kind of recognizing that that's what I have been, as a caregiver while working and leading the work that I'd been leading professionally. But also my mom and I lived together for 13 years. She was my roommate, my adult roommate for that long. And so I just didn't notice. And here I was questioning this quote. And in that came the beginning of my involvement with the RCI. And I had the privilege of serving on the board. And that at a time of transition, which we can all imagine as families go through, when the luminaries of the family, the foundation of the family, are starting to pass, it was important to make sure that we had really great grounding on how we steward the work forward. And that's where I was. And in doing it, she had asked me some questions, which made me finally appreciate what was happening. She had asked me if I had seen myself as a caregiver. And here I thought I was asked to meet with her because of my global health career, given the Carters and what they do in global health. And I brushed it aside. And then she asked what my mother did. And asked if she had taken care of my grandmother. And I said, yes. And did my grandmother? Yes. Did my father? Oh, I don't know. Did they quit school at any point of the way? Did your mother finish university? I'm like, no, she got married. And she said, did you interrupt your education in any way? I said, no, ma'am. And I was unclear as to where we were heading. And she goes, what does this ABD mean? And I said, well, it means all but dissertation. And she said, well, why did that happen? And I said, well, I needed to get back to my HIV work and da-da-da-da-da. And then finally, I disclosed that my father's dementia began. And I became the primary breadwinner for my family at 28. And she said, you see. And I said, ma'am. And she said, it passes from generation to generation, this act of care. So that was very meaningful. And that helped me see that you can't really live a compartmentalized life, especially if you're in a professional field of health or healthcare or social well-being. And I'm going to add in more recently, or financial planning. Because at the end of the day, all of those things are resting on your own tough Sunday night. You're experiencing the very thing you're leading in on Monday morning. And I can admit that I didn't necessarily connect those dots, that my weekend that might have been filled with a lot of complexity may not have guided my decisions on Monday or Tuesday when I came back to work. Partly because in healthcare, we're trained to compartmentalize it, especially public health. It's for the masses, not the individual. But in the end of the day, now I see it very differently. And that work, not only because of conversations, and I only had a limited few with Mrs. Carter, but just the work itself helped me recognize that no, you have a moral responsibility if it is your profession, even more so if you derive a salary, even more so if you're in governance of any of the things that are inside of these sectors. Because at the end of the day, we're all struggling from it. And we have an opportunity to have some courage to ease this struggle, not just for ourselves, but for others. But even asking the question, is this decision making my day easier or my team's day easier? If it's not, then it's worthy of a pause. At least acknowledge that. There are a lot of other factors that push why we make our decisions, but we can make that more conscious and more aware. And our times today require it. So those are the big page turns for me. And so now, while we have an unrequited need to tell our story, and this is a beautiful place to tell our story of care, it's with now a responsibility. What's the next decision that you're going to change so that it's easier and better? So that's how it's shaped me now.
Well, I love that Mrs. Carter asked you about your mom and asked about caregiving and didn't really lean in on your career. Really straight up. She asked you about caregiving. And, you know, I think you and so many of us, because back in 1985, I did not see myself as a caregiver. So many of us do not. And how appropriate is it that I have you here on Health Futures in the month of November 7th here. We're recording this, and it's National Family Caregiving Awareness Month. And, you know, we have 63 million, I think it is, Americans that are making the ultimate sacrifice. They are literally the silent, unsung heroes that are making sacrifices that you described, sacrifices that I have, that are making a difference in the lives of their loved ones. Could be a neighbor, could be a friend, but just helping somebody through the aging continuum. So, I really want to ask you about the significance of this month, and certainly helping people identify themselves as caregivers. And more than that, helping them understand that there are resources out there. The Institute was one of them, but there's so many other resources out there. So I want to, just punt it over back to you to really talk about this, because, it shouldn't just be November. It should be all 12 months out of the year.
Right.
But this is the month that we really take an opportunity to really draw attention to it.
Yeah. Well, first, thank you for recognizing it, and how terrific that we are choosing to have this conversation during this time, and punctuating that the conversation isn't to begin and end only in these next few weeks. So why it's important? First of all, the 63 million it's grown, right, from the last time that we talked about these numbers. And it also is dependent on whether you disclose or not. So we know it's much more than that, because a lot of us don't identify. My long story is really to demonstrate that I didn't identify, and who knew, from 28 to 56, my entire adult life, I was also doing this while also in my career.
Wow.
Many of us.
And if you think about it, there are 345 million Americans.
Correct.
So if you do the math, it's almost 20% of our population.
For sure. And while we think about caregiving, there's, of course, parenting, as well as taking care of elders. I'm going to lean in more on the elder care part of it. One, because my direct experience is that I don't have children, although I have helped many who do. That said, the reason why elders is because it's outpacing childcare in many ways, and the demands that are coming are unseen so quickly. And so elevating the fact that not only are we all caregivers, yes, it's one more title on a list of titles. It's also recognizing a couple things. One, I don't think I can say for myself, I never saw it as a burden.
Thank you for saying that, because I never saw it as that either.
I knew you would jump right in with me on this.
No, because I describe it as a labor of love.
It is.
What an honor it is for us to care for the people that care for us once before. It's a great honor.
And so some of it in the framing of how we're talking about this is important to balance. And so I think we all want, in the best of circumstances, to be able to be there for the people we care about and love. Family, however defined, neighbors, however defined, community, however defined, in their most important days of need. the growth of that need is what's in front of us, that many, many people need us. And how can we do that while taking care of us as well and taking care of what we may need for our own livelihood is important. So to be seen, you have to identify. So I think that's why it's this important to say who we are and to say it with pride and to have our own stories. And having said that, then to quickly connect it to what our areas of expertise may be, because the needs that are out there for us as people who are taking care of people and for those who need our care are more than just health or in financing things. They're broad. So every one of us has part of a solution in this as much as a need. And so being very, very crisp about that is important. In addition, we're also in a pandemic of a different kind, which is loneliness and social disconnection.
Thank you for sharing
the very
this.
thing that we are doing by choosing to join in providing care and being of care with someone is also receiving that care back. Why didn't I not necessarily feel like it was a burden? Because having my elders help me in return was a bigger, I see it much more now that they're gone, was a much bigger kind of transaction than I realized. I needed that desperately. I purposely live in a community that's actually filled with people older than me, because it matters when I go walk my dog, because they are noticing things that most people don't notice today, right? And they openly come forward and say, hey, do you need something? And then we can respond and say, can I help you in return? Some of that tradition of doing that kind of very personal exchange has faded in just the hustle and bustle of how we are in our world today. And you and we briefly met.
Yes, we have.
In California. But candidly, we've become closer because of a 2D experience that allows us to share more eye contact than ever before. That is the one thing I will tip my hat to with the virtual world we're in. We look each other in the eye. And we weren't always able to do that in 3D.
I love that.
But this community, when I walk my dog, we look each other in the eye now. And all of that is a part of the ingredients of being able to show care and show connection and alleviate even a small bit of the loneliness that's there. And that's more recently than in the past, I start there because all of the tactical things of care are important. But that's where the burden conversation begins. That's when the weight of things begin. That's also where other people who help us can step in and help us and show us that they care about us as the ones who are taking care of others. That's when all of a sudden all of the Indian curries that would end up at the doorstep when the pandemic was hitting and I needed help without my asking would show up, right? When the phone calls would start differently, when the need for Zoom turned into something else because they needed to see in my eyes, is everything okay or not? All of that is the next concentric circle of the people that are around us, where maybe that tactical work can be more helpful, but also the nonverbal parts of care can show, because we have to restitch this fabric of caring for each other. That's when the loneliness and the social connection parts will start to come back to where they need to be.
And I'm so glad you bring this up. I mean, look, we have many that are solo aging, but caregivers, they go through this isolating experience, and really, they are separated from their daily activities.
Yeah.
They don't really do what's necessary to take care of themselves. I mean, there's a data point. I don't know if you and I have shared this before, but it's over 10 years old and it's still relevant today. That couples caring for one another 65 or older without outside assistance from family members, friends, neighbors, or even professional home care agencies like ourselves, 63% of the time, the caregiver predeceases the care recipient. And that's tragic. So, you talked about getting out. I mean, this is a global problem, but, we're here talking about the United States, and I'm here in Arizona. How do we, get people to get out and get away from being isolated?
Yeah.
Because, you and I both know the support groups are great. A lot of people feel like no one can relate to them because they're going at it alone. Both of us having been family caregivers, we know that. But, how do we get that message out to caregivers to let them know that, hey, you know what, you're not alone.
Yeah.
There are resources out there.
Well, I found a more indirect way to be more helpful because when anyone who is overwhelmed, even at work, caregiver or not, one more thing that adds to the list of what they could be doing, even to make their life better, is one more thing. When you're overwhelmed, putting self agency back on someone who's overwhelmed doesn't help. And that's, I think, the dynamic right now of a world that is self-sufficient and giving us so much technology to stay self-sufficient, and longevity being the goal, independence being the goal, is butting up right against this isolation problem, right? So how to think about it, I think, is really in that next concentric circle. How can you offer help to someone independent of whether you know they're a caregiver or not, because they may not disclose? But if you're noticing, hey, the gang's getting together and someone keeps opting out, notice it and see what's going on, right? If someone has said, listen, I got to go stop and spend the weekend with my mom because she needs X, Y, and Z, saying, listen, I'm going to be running some errands. Can I pick up some groceries for you so that when you get back, you've got what you need? Filling in a gap with an idea, even if it's the wrong thing, taking the risk, even if it's the wrong step of help, shows that you care. And that person, absolutely. Wouldn't we just come back and say, gosh, that is so generous of you to think about that. If you don't mind, I actually need someone to make sure that my dog gets an extra walk in that day. Do you mind taking care of that? Right? That starts the conversation of getting back some interdependency in a world that is this isolated, but because we have celebrated independence to this extent, right? I often say that Ring Camera was never created to voyeur on our parents. It was created to keep us safe from the outside, not to keep us separated from the inside. And I often now wonder, when I choose to text someone while I'm watching TV versus even leave a voice recording, right? Do something that's a little bit closer. It's partly because I don't want to do it. Right? There's a separation that's there because there's so much else going on. But some of it is, how are we going to say no to some things and yes to others, and figuring out a good middle ground. So I'm answering the question in a more indirect way because the caregiver themselves can only do so much. It is a time now for the system and the community to meet them. I'm going to add one more factoid out there for you on the one that's 10 years old. In August 2024, just last year, a little over a year ago, CDC reported out an MMWR, which you come from the HIV era, which I did. The first slide of anything from the HIV era was an iconic slide of CDC MMWR, which is their weekly report, morbidity and mortality weekly report on what's going on. So we lean in on that because that's when HIV, before it was even known as that particular condition, virus, or disease, was reported that there's a cancer among men of a certain area, of a certain place. So I leaned in when I saw the MMWR in August last year that said 13 out of 19 health indicators are disproportionately worse for caregivers than non-caregivers. The very act of care is now a health determinant. It's a positive one if you receive the care. It's a negative one if you deliver the care. Now pause on that for a second. We already know that for the health workforce. So if you professionalize it, we already know that. But now it's bleeding into every one of us that cares. So I'm infectious disease trained. So in that parlance, we have gone now from a contained epidemic to one that's moving into the general population. When was the last time we saw that? COVID. How did we respond to it? Lots of mixed views, but it became an emergency and resources were redeployed. We are in that emergency now.
Well, we can't treat this one with pharmacology. That's the biggest challenge.
Or from isolation, right?
Yeah, or from isolation. Exactly. Right. But what's interesting is, as you've said, and I share this often, especially during this month, but all year round, if you know of someone doing the hard work, doing this care, of course, offer.
Yeah.
Remember, this generation that is now leaving us, and I'm talking about the silent generation, the GI generation, the greatest generation.
Yes.
They really took to heart in sickness and health, and they feel like it's their responsibility. So what I typically say to people, look, ask, and if they say, I've got it, then just do. Just help.
Yes. Yes.
If you're going to the grocery store, pick up a couple things for them. If you're cooking a meatloaf or casserole, cook two and drop one off.
Yes.
Because they aren't going to admit that they need help because they feel like that that's their responsibility. But
For
I
sure.
really love how you framed it, because it really is an epidemic. It's a pandemic of its own, and it's only going to grow.
Mm-hmm.
And, for me, come from a world that, we're in the early stages of helping out with HIV and AIDS. And, for me, it took a social impact to make that happen. And that impact comes up a lot in social initiatives, and sometimes too easily. And you've warned us that we must not confuse effort with real impact. In the work that you led over at RCI, and that's for the Rosalind Carter Institute, how did you define and measure true impact with caregivers? And more importantly, can you give us an example of a program approach that you feel genuinely moved the needle for caregiver health and their well-being?
That's a great question. And I have to say, while I had the privilege of leading the organization in its final days, anything that's impact oriented is from the prior CEO, Jennifer Olson, to Mrs. Carter herself, boards all in between, and the staff that have worked so hard, and the community that they were working from in and around Plains, Georgia, and Americas. One of the things that is important on this one is we're talking about impact today, with a lot of organizations that are only getting started today in what was framed as the care economy just a few years ago, right?
Mm-hmm.
This organization, there's probably 2 or 3 that have been nonprofits that have been specifically focused on caregiving that have spanned decades. RCI is one, Caring Bridge is another, and I sit on the board of that one. There's another organization called Jack's Caregiver Coalition that's 10 years old for men who are caregivers. I focus in on them because when we talk about impact, you have to have been in it long enough to have kind of pivoted through a lot. And so with that in mind, and there's some impact papers I know that the team had produced when we were together at RCI that illuminate some of that impact based on those days and the period of time. And a lot of it was self-agency, right? The ability to do things on their own. If you're a caregiver, do you feel confident to be able to do what needs to be done? Do you feel supported? Very much of a self-reported view that you have community around you. In more common terms today, some of that pivots over to the mental health space, right? Are we feeling less overwhelmed? Is there something that is happening because you've got that sense of community around you that lets you feel that you've got the ability to function? Some will have some self-reports of less diabetes, right? That their A1C levels have decreased. Hypertension may have decreased, all self-reported. The data that I reported out from MMWR, some of that was also survey information, right? So do we have clinical information yet? No. But impact at that time and over the years has very much been from the caregiver's perspective. Do they feel the support that they need? And that continues today, right? Even in the examples that we're talking about where people can step in, it's to alleviate that overwhelm. Now, today, we may be looking at things a bit differently, right? We may be looking at, do you feel less lonely? Which I know Caring Bridge and others, it's even in their mission so that no one goes through a health journey alone. So, of course, that sets it up. Well, do people feel less alone? Right? And then, if you're making a difference, if you are able to frame your mission so beautifully where the impact is already seen in the words and now you just need to deliver on that promise, and how are you doing it? That's the best. And I hope that the new organizations coming into this space are doing it that astutely. But today, because we're seeing so many of the solutions come up through the health system, there's going to be a different bar of really demonstrating that there's a clinical difference. Right? There's a relief of the health system somewhere. And unfortunately, in the first round, and I say unfortunately, is we're viewing caregivers as health labor, that they're part of the workforce now, that it may be making the care recipient better, but back to that MMWR, but they themselves may be sicker. So if that's the case, then we've got to think through, are we really broadening our approach to make sure that while they're doing what they're doing, and they're not doing it only because the health system didn't have enough people. And that's minimizing where you and I first started, right? It is a labor of love. Mm-hmm. And that combination of, yes, the silent generation, the great generation. I'm going to add one more, the partition generation from my community, right? They are the ones that work so hard on their own, but boy, do they feel great when someone else is right there. And it's got to be their trusted one. And silently, it's going to be somewhere in that cone of how family was defined. So while they're doing all of this, how are we supporting these folks? And in today's world, there's more that's around what is the workforce doing? Is paid leave offered? Is the health plan that we're putting in front of people offered? Why is November this important? This year, I'm looking at it very differently. I think a lot of us are. It's the fourth quarter of the year. What do we do as individuals in the fourth quarter of the year? We rebalance our health plans if we're privileged enough to have one. We figure out what are we going to need. We figure out financially how's next year going to go. If you have the time and bandwidth, you're also sorting out how are your taxes going to likely look in for as you get closer into next year. All of that, all of those categories have a caregiver element to it in projecting for what you might need. And none of them are purposely asking that question in the way we do for kids when they go to college, right? Every one of them are asking about your kids, but we're not asking about this. So the preparedness part of this is important in November. I bring all of this up because in order to really come up with a new solution here, we have to look at the problem differently and the opportunity differently. I know that I was able to work longer because I had some of the services that are available now through my employer. Wealthy was one of them at that time, right? There's empathy once you move through the end of life stage, another group that comes in. Caring Bridge was a part of it. There were many different groups that were a part of it because I knew a lot. But it's going to take a lot of people coming in to help. The last piece I'll add is we're also now very aware with wildfires, floods, earthquakes, you name it, natural disasters.
Or 120 degrees here in Arizona.
100%. Correct.
It's like living on the sun. Absolutely.
Oh my gosh. And I'm on the other side of it, right? Where it's going to be, we're getting our first snow in Minnesota this weekend. And before you know it, it'll be 40 below. And snowstorms and blizzards. How are we making sure that these emergency events have been prepared for so that when it happens and you've got someone like I did with my mom on oxygen while I was stuck in a fire in California, she's living alone. Never once did it occur to me that we need a plan for her if something were to go wrong. We might have a sticker on the window for a dog that might be in the house, which we do, but we don't have anything necessarily systemically that makes sure that the elder is settled. And so that is another huge part of what the Rosalind Carter Institute did in the past, is really bring up this emergency response, partly because of the Carter legacy and FEMA and all the things that we did to get ready, but also irrespective of that. It's important because there's only so much a caregiver can think through. And this is where what you do in your industry becomes so incredibly important, because that person at home helping with healthcare and the rest can help us get that emergency plan and ready to go well before it's something that's on the horizon for us. And if you're a caregiver, the last thing you want to do is project a future where there could be a hurricane. Like, okay, I'm dealing with today's problem. I can't worry about the next season. But someone else could take that on and make sure everything is set and ready so that it is ready for me and for who I'm taking care of.
I think it's so important that you bring up emergency preparedness, because that's not something that we'd all don't think about. You know, Paurvi, I think it's very apropos that November be National Family Caregiving Month. With the amount of dementia and Alzheimer's that we are dealing with in our country, and the fact that, you know, we talked about it before we started the show. The Diwali holiday just passed. It's a holiday of light. We got Hanukkah coming up in December. We don't have enough light right now. It gets dark early.
Yes, it does.
And up in your area, it's probably dark before 5 now.
It is.
And you know, it's getting light later. And you know, here it's almost 7 o'clock before it gets light. Yeah. But there's a thing called sundowning that many Alzheimer's and dementia patients go through. And that's hard work. It really is, because, you know, a lot of families that are doing this labor of love don't really understand how to handle or cope with a loved one that is confused, that could be combative and really be challenged. And sundowning is usually occurring late in the afternoon or early evening. Confusion sets in for a lot of those people that are afflicted by Alzheimer's and dementia. And, you know, what really complicates matters, and I know you know this, we haven't talked about this, but women are predisposed to getting Alzheimer's or dementia at a 2 times factor than men. And women are the primary caregivers. In families, it's typically the eldest daughter who is caring for the parents. So we have quite a conundrum ahead of us.
Yes.
But I think more importantly, it's to draw attention to this. And really, I talked about impact is really to, create an impact and create a movement to really help these families that are so struggling right now with caring for their loved ones and being able to make their days the best they can be. The thing I love about home care and the work that we do is that we do get an opportunity to help families through this journey. I like to say it's the final chapter of their lives and make them the best that they can. Oftentimes, people can't afford home care. It's become unaffordable. Just in the last 5 to 6 years, it's grown 40 to 50% in cost because of labor costs. So we have to figure out ways to do this, and we have to have resources, and we have to have impact. It's interesting here in Arizona. I'm going to say it was probably 4 or 5 years ago where, teachers were, really, really challenged in terms of what they were getting in terms of pay here. And we had over 50,000 teachers march on the state capitol. And guess what? They were able to get the needle to move forward.
Sure.
But we can't get 50,000 caregivers, family caregivers, to come to the Capitol because they're caring for a loved one.
For people, absolutely.
So really it's incumbent upon us and others that are out there to be able to be that voice and to be able to speak for them and to say, hey, we need to do something. Look, I think, and I know I have an agreement with you, I think two of the most important professions in our communities, in our country, are caregiving and teachers. And they are typically the most underpaid.
That is true. I mean, I think if I were to think about impact, well, there are two things. I love that you brought up this light and how that kind of translates even into the space that we're in. So I want to start there first because it comes back to neighborhood. I can reflect on my dad and the things that would put us in a panic and what was happening. That confusion ends up with wandering. Who's a part of the group that makes sure that everyone's well-being is sought after, and it is the neighbors. Who brought back my dad? It's going to be someone in the neighborhood, a police officer, some very, very local. Back to social connection and isolation, and why we need to be out of the house and connected is because at the end of the day, the first wave of who needs to be in this response are the ones that are neighborhood actors, right? Whoever is working from the neighborhood up. They're also going to see when the caregiver themselves is starting to fade. So even the formal caregivers that you all work with are going to know faster than anybody else that, hey, the family member is starting to go. So there is another way of maybe redoing the plumbing on how we actually address healthcare. That is a different kind of advocacy, which is around the negotiation that we do inside of healthcare and how plans are put together. What kind of reimbursement can we expect? Can you, if for the expense of having someone in the home, is there a way to double take care of folks and get to greater efficiency? Does it work today? No, but it's going to take the creativity that silent generation, that partition generation, that other generation in front of us had. That's the system we got because they knew to come up with it. It's on us to change it. And that's more than just getting to Capitol Hill. That's us in the jobs that we have. Back to what I was saying earlier about we're over compartmentalized. If it changes your decision on Monday morning, what would you change? And where would you have the courage to start? And until we do that, you can't expect it to just happen on Capitol Hill. And that's exactly how it happened in HIV. And we lived through that in different ways in the 80s. So we know it took multiple ways of getting things to happen. And I'll say with great reverence, the National Alliance for Caregivers just finished their meeting this week. And they had a Hill Day, right? Where people were together and able to knock on doors and get things done. We've got great, whatever side of the aisle, people are very aware and are trying to do what they can in this moment. But this is back to it being the kind of overwhelming emergency that it can be. It's hard to know where to start. And it's not time bound. It's not like once we get this vector under control, we're going to be able to go back to what once was. This is now the new era of healthcare. This is now the new era of how we come together. So if you could architect should it be, now's the time to sit down and figure it out.
100%. I think we are making progress. It's a slow progress.
It is slow.
The Centers of Medicare and Medicaid Services, CMS, has put together a program. It's called the GUIDE program. And that GUIDE program is out there where CMS now recognizes that the family caregiver is taking on a lot of the stress and responsibility of caring for a loved one with dementia and Alzheimer's. And CMS is now authorizing and giving those families an opportunity to get respite. Now, the hours aren't that great. They're in the 70 to 80 hours a year. But for me, it's a start. Mm-hmm. And the fact that CMS recognizes this is a big deal. But we can't wait till 7, 8 years when the program is finished to be able to discern whether this was impactful. Because 7 or 8 years from now, it's going to be a whole lot worse. We know it is. So it's a great first step, but we certainly have a lot more work to do. I love that, there were people on the Hill just this week advocating for it. I go to Washington, D.C. at least twice a year to do it. And I spend a lot of time here in our state legislature. But we need to be the voice for that silent army out there that is making a difference in so many families' lives every single day.
Absolutely. I mean, I would add one last thing on what CMS is doing and with GUIDE and with many other things. The importance of cultural adaptation needs to be brought into this discussion because, again, like I mentioned, especially at home. So for all of the folks that are trained to help us at home, we're not all the same. And again, that's not because of what part of the world we come from or our ethnic background or religious background. It's just family structures are different. And so in order to be able to meet that moment, we've got to recognize that even something like respite has a lot of layers in it, depending on family dynamics, what's driving someone to be there in the first place, and what would it take to actually be able to leave. Sometimes it's not the time part, it's the relational part and the level of coaching that's necessary to help people understand and how to nuance that. So this time of testing, right, with this opportunity that CMS gives us under GUIDE, allows us to get in early and try and disaggregate for different kind of dynamics so that we can figure out how to scale. Because if we don't, we're going to be behind again, right? My family took uncles and aunties again to come in and say, we're going to have dinner with mom. And I'm like, okay, and putting out all the dishes, including mine. And they're like, no, you are going to go find out who you're going to have dinner with. Now, my mom accepted that because it was uncles and aunties, and it wasn't a judgment on my relationship with my mom or me getting off on the easy by not having to do dinner.
Right.
But if a respite service had come in, that would have been an entirely different dynamic, and it would have been hard to introduce. And so there are folks, there's a researcher out of Canada who's actually starting to pull this forward and push it through on LinkedIn and other places. I'm doing it as well. But depending on where you come from, there may be some easy tweaks. I'll end on this one on ours. We were running into an issue that my mom needed to have a med with her breakfast in the morning. But we're Hindu, which means she won't eat unless she's bathed and prayed first. Now, if I didn't have a health worker here to help me first thing in the morning, and the health worker was coming at 11, that meant she wasn't going to take her med until lunch. She's not non-compliant. It's just that there are cultural factors that get in the way to be able to help her take her med when she needs to take her med. All that took was changing a training. It happened live on one of these CME moments where they changed the training protocol. They were able to ask the question up front. And now, scheduling aside, of course, there's so much complexity with that, right? But at least the input is there. And we know this information when people go into the hospital, right? There are plenty of surveys that are asking a lot of questions that help us get a little closer on these issues. It's now time to use them. And if the complexity is another one, I know you're working so hard on that complexity, right? How do we then answer that problem? 100%. That's a different problem. And we can work together on that. That will bring social connection together. Because if we are able to address a neighborhood together with care, formal and informal, haven't we helped with social connection just by the very nature of doing that? So there's something here that is going to be, a solution for many problems that I know is inside of the industry that you lead in, and one that I'm trying to be a part of and influence through these conversations, because I'm that solo ager too, right? I'm an only child that didn't marry, doesn't have children, doesn't have parents, doesn't have siblings. I'm the beginning of this next wave. I'm also that Gen Xer who turns 60 very soon.
Right.
So when we solve it for me, I may want a dosa every week, but I don't want it every day, which means some meal service is going to have to figure this thing out, right? Mom's Meals needs to start to include a few things when it's a part of my Medicare Advantage plan. All of that is our opportunity now, is to figure
Well, it certainly fuels your passion. I've got a couple questions as we conclude.
Yes.
Mentorship and leadership development are clearly very important to you. And you have served as a mentor and have been involved in programs like Women Lift Health. What advice do you find yourself giving to emerging leaders in public health or social impact fields, especially to those who, like you, might be balancing a rising career and maybe caregiving responsibilities at home? How can they thrive in both roles without sacrificing one for the other?
Oh, that's such a beautiful question. Thank you. I'm going to start with a quote that my mom, I invoked this quote earlier this morning, that she said as she saw me struggle when I didn't know what FMLA was. Mind you, I worked in global health, which meant taking care of everybody else's health.
Mm-hmm.
And I struggled within my employer at that time. And she said, wow, look at all of you working so hard to take care of the world. You don't seem to take care of each other very well. So I'm going to leave you all with that. Because back to the responsibility of being in a sector, in an employer, as an employer, have we taken care of our own first? And if we haven't, who are we to advise, go on the hill, do anything else until we sort through our own experience and our own struggles and try to change it, right? So with that in mind, for the women that are coming up through Women Lift Health, or the men that are coming up also as caregivers, like I said, I wouldn't be the woman I am today if it wasn't for a father who was a caregiver. All of that is in recognizing that you've got to ask the question. You've got to ask. And you need to, and my best friends today are still the ones that I came up in my career because we were in part of a social cause. And because of that, they're the ones who helped me understand FMLA. And me feeling some shame in them, like, who am I to be advising the rest of the world on healthcare when I didn't even know my own? All of that comes from just knowing to ask and making sure that you understand your own health plans. As people become leaders, to start now in making sure it's a porous wall between your Sunday night and your Monday morning. Don't wait until later to recognize that compartment should have come down. You're already in it. So, and this generation is far more courageous. My mom educated me. I was raised by partition generation parents, so my courage will come a little later. It'll take a few generations, and she's right. But this one is going to ask, and they shouldn't be shamed for asking or raising the question, have we done this for ourselves? And if you can't raise it in the room, then ask it of your benefits provider. Ask it where you feel comfort. Ask it of your financial planner in the comfort of where you're at, but ask.
I love it.
That is where it's going to come from and tell your story. It's yours.
Love it. So last question, ThirdEyeFocus.
Yeah.
So this is on a personal note. What continues to drive you in the work that you do every day? You've built a career at the intersection of global health, corporate responsibility, and caregiver advocacy. What is it that fuels your passion to keep pushing for, as Mrs. Carter envisioned, a more caring society where each of us is seen and heard? Is there a core lesson or inspiration from your own caregiving journey that you carry into every endeavor that you take on?
That's a deep question. So I tend to look across versus down. You can hear it in some of the examples.
Exactly.
And that fuels me because I see some dots that ignite my interest, my intellect, and my curiosity, all three. But I also am, in Mrs. Carter's definitions, I'm a former caregiver and a current griever. What I find to be important now is to put voice to both. The demographics of where we're at, we will be a society that is feeling through caring for each other and loss more so than any other time, just because of the volume of what we will be doing. And so the more we start
100%.
to say this out loud, the better. And so what fuels me is to advise into that as best I can, because I am a former caregiver, which means some parts of this are behind me now. And I came into this early in my life, including my grief. My parents died in their 70s. So I can carry some of the weight if I can. I'm looking at things like how can fractional leadership be a solution, a workforce solution for both. So finding a simple solution to multiple problems that is helpful for the crowd that's coming behind me. Because I'm a solo ager, like many of us, we are going to be a +1 on somebody else's list. My job is to make that easier for them as best I can while I have agency to do it.
I love it.
And I have had the privilege of working in a lot of spaces, in some places where I can try and help because of my training and my expertise and my story. But I'm also among the first of the second generations that are getting older now. And so, yeah, I'm fighting to have a dosa once, but not my entire meal, right? That is going to help everybody else coming up behind me. And that's how I'm going to keep going. So I find it amazing that you and I found each other in this world to have this conversation. I know you too, as a father of girls, are raising women who are going to be doing exactly how I've been doing this work, because I was raised by a father that was very similar to you.
Thank you, Paurvi. I am a girl dad, and I am a proud girl dad. And I want to, as we wrap up the show, is there a question I have not asked that you wanted to convey on Health Futures today? Or is there like a lasting thought you would like to leave our listeners and viewers here today?
That's a great question. I would say, what is the one big innovation that needs to happen so that we as people who care for each other can have the freedom and agency to just care for each other and allow for the best quality of healthcare to do its job with fair wage, with fair recognition, with full talent, and allow for daughters and sons and neighbors to be able to be those roles? What is the one big thing you can do to allow us to play the roles we're here to play? And if I choose to bathe my mother, I will. But I'd rather eat with her, play cards with her, listen to her stories, because I know the very best of care is here to take care of her, and that's been reimbursed beautifully and in a thriving way. So what's the one thing you can do? And today's a Friday, so when you go to work on Monday, keep your eyes open for it. And if that means ask for a benefit that doesn't exist today, ask for it. Demand is what's going to change this.
Well, I love it. Empowering people that are listening here to the show. Paurvi Bhatt, I will tell you, you're my new friend, and I feel like I've known you for so long. And while our journeys were parallel to one another, I'm so glad that they've intersected. And I'm so glad to have had you here on our show today at Health Futures. So, Paurvi, we're going to have to say goodbye, but thank you very much. I'm looking forward to the next time you and I get a chance to meet one another. But to our listeners, it's National Family Caregiving Month. We have the holidays that are upon us. Thanksgiving is just a couple weeks away, and Christmas is just soon thereafter. Take inventory of your family. Take a look at who is helping one another out. Take a look for signs. Look for confusion. Look for maybe, poor hygiene. Look for bruising. Look for forgetfulness. Look for the signs of somebody maybe struggling. And don't offer, just do. Help them. Help them through this journey. This labor of love, it's a beautiful thing. Both Paurvi and I have worn those clothes, walked in those shoes, but it's hard. And you know what? Sometimes we don't ask for help. And that's what we're asking from you. Please don't ask, just do. Thank you for joining us here on Health Futures. And Paurvi, thank you for joining me here on our show. Make it a great day. Have a great weekend. We'll be back next Friday. Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years. It's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.